I'm Helena and I'm the manager of the daytime team of REST. We're delivering one-to-one support for people that are entering a crisis or maybe a few days past the crisis. At the moment we offer the support either virtually using Zoom or face-to-face in our current offices, which are based in Norwich City Centre. So the reason that we have REST is because quite a number of years ago we identified that though there are lots of clinical support services around Norwich and some amazing charities doing great work where they were getting to meet with people, there wasn't a place that people could go to get support, get advice, get information, and also feel like they're part of a community. So we recognised that we wanted somewhere central that people could go to in immediate need, but also feel that they are part of something and that it's not just entering a building where it's a mental health service. So we created REST to feel like a very much a community centre in a very idyllic place, but still very central to Norwich. So we've got our premises on Bethel Street, and it's going to be a space that is open to any member of the public to come in. So there's going to be a cafe there delivered by the feed. So if you're just a general member of the public, you can go in, have a coffee, have a sit down. We've also got a resources library there, which will be filled with lots of information and resources about mental health and the different support services that exist, and also just things that you can do for yourself around self-care and making those connections with people. And that is going to be absolutely accessible by anyone as well. There's going to be staff on site. We're going to have a mix of volunteers and staff members, so you can enter that space. If you want to talk to someone in an informal way, then you can do. If you need something a bit more than that, then we have everyone there who can straight away come and be there with you, talk you through whatever's going on. That can be done in an open way, or it can be sort of, you can go and have a meeting and have a more immediate one-to-one if that's what you're needing. So yeah, it's a very much a bright, welcoming place where there's a range of different people, so you don't have to feel like you're going into something asking for help, but it's the help is there when you need it. I think if you were someone that was walking into that space identifying that you needed some help there and then, there's different ways that you can access that support, and you can choose, very much it's up to you choosing what you need. So you may speak to someone there on the day and get a bit of information from our resource library, take that away and never feel the need to come back to ask for any further help. Or it might be that you do need something longer term, and you would then have the opportunity to sit with one of our recovery workers. They'd get to know you, find out what's going on for you and what you might need at that moment in time. If you feel that you do need some continued support, then that can be offered for up to 6 weeks. That support can be one-to-one sessions, or it could be joining our Chime programme, which is a number of workshops all focused around a different topic, and that's one way. So it could be one-to-one support, or it could be joining group programs. You may do a blend of that as well. If you are entering the space, coming into Churchman House and feeling that actually things are really overwhelming for you right now and you need some immediate support, then we would refer you to our evening sanctuary team. So we'd invite you back later on in the day to sit and have a 2-hour session with with one of our recovery workers who would be looking at the now, the there and then, what can we do to help you, and make sure you're feeling supported and empowered to take those actions. And then off the back of that meeting, we would invite you to come and access the support for that longer period of time with a one-to-one support worker or recovery worker. So at the moment, all of our sessions have been delivered one-to-one. So either one-to-one with a peer support worker or one-to-one with our recovery workers. Some sessions have been joint sessions where you get the opportunity to look at things from a reflective point of view, to understand your experience and make sense of that, and also to make those plans and look at goals for the future. And the one thing that's been missing, because we've not been able to deliver it while working from home, is our group programme, which we've called the Chime programme. And Chime stands for Connection, Hope, Identity, Meaning and Empowerment. And that's the really grounding kind of scaffolding of what we want to be doing here. So we're not looking at medication or therapy. We are helping people identify what they need and help them achieve that. And so with the group programme, there's a total of 16 workshops which can be done across a period of weeks. It may be, if your availability is such that you can attend 4 a week, you could get it done within 4 weeks. If you can only do 1 session a week, then it might take a bit longer, but it's very much about fitting into your schedule. And each section of Chime is 4 workshops in themselves, and they are delivered as a group. So you get that opportunity to meet with other people. And coming into the space that we're now in, we've just been really lucky that we're able to start delivering those sessions. So we've invited some of our past users of the service to come and trial it out with us. So just last month we delivered our first 4 workshops to about 6 people. And the purpose of them coming along was really to see how it feels, engage with it, and give us that feedback and really co-produce those workshops, so that as we deliver them going forwards, they are absolutely meeting the needs of the people that are coming into that space. We've just done a feedback session this morning, and the feedback is really, really positive. Overwhelmingly, everyone said it was really worthwhile and that they took a lot from every single session. And what we really got from the people that have attended so far, which was just really, really lovely, is that it didn't feel like they were being lectured at, that they were attending a course. It felt like they were coming into a safe space where they can meet with people who may have similar experiences, even though the situations may be different. And I think that was what was really lovely, is hearing at the end of every session, when we just kind of spent 5 minutes reflecting on how it had gone, is that people felt less alone, and they were surprised to hear that other people felt the way that they did. And I think sometimes we can think that actually everyone must know that everyone has mental health, and we experience it in similar ways, in different ways, but actually to have that really reinforced in a group, in a really safe space, it like was amazing to see, and people were feeling immediately connected. They were making really lovely friendships, and this was just within 4 2-hour workshops. So that was a really lovely reminder of why we do what we do, and what we've then taken from that, and what we want to do going forwards is make sure that when we're inviting people to the workshops, it is creating that safe space that they can go to, and they can talk, and they can be open about what they're experiencing. And I think that being safe and feeling safe is sort of the single most important thing in managing your mental health, and those connections are just fundamental to living a meaningful life. But we're really, really key and really focusing on the fact that it's not just about being present in a space, but it is making those connections, and that's what the workshops are really built around, is bringing people together. So we have some time sharing our experience, and other times working by ourselves and working in pairs, so that the end of every workshop, someone has got something that they've taken away and they have built something meaningful. So I'm the recovery team leader in the service that I run, the REST daytime service. What that means is that I have a team of recovery workers and peer support workers, and they are doing the frontline work. So they're getting to meet people on that one-to-one basis and delivering groups. And my role within that is to literally support them to do that. So that might be having daily check-ins with the team and reflecting together on things, and looking at challenges and difficulties, but also really focusing on the successes and sharing our experience so that we can come up with solutions together. And I get to be the person that helps do that, and it's great. I was working within the service as a bank worker, and I felt that provided some really great opportunity to get to know the different services that were existing. So I was able to work across different services that were delivered by Norfolk and Waveney Mind, but I felt like I couldn't get my teeth into it enough. So I became a recovery worker team leader, because I wanted to support a wider group of people. So I love working on the front line and meeting people one-to-one, but I wanted to be able to have more of an impact and take those services that are so amazing and really fine-tune them and be the person that connects the team to their manager, so the person actually managing the service. And being a team leader, you're in a very special situation where you've got a connection with your team, where you're their person, you're their representative, they come to you first, but you've got to take what they're saying and what they need and work with the manager to make that workable. So for me, it was about being able to be that link, that bridge between the frontline work and the needs of the organisation. I think the best part of my role is when I've got someone coming to me, whether that's a peer support worker or a recovery worker, and they're saying, I've got this thing, I've never done that before, what do I do? And we work through it together. And for me, it's not about sitting there and giving an answer, it's about having an open conversation, coaching them through a problem or even something that's gone well, and finding out, well, what was it that worked there or what didn't work. And I just absolutely love being able to take that conversation and then having that actually then be out in the support that we're offering. If someone was asking me why would they want to come and work for Rest, I think I would be telling them how Rest is a potential solution to something that was really needed within Norfolk and Waveney. But what I love about it is it wasn't just a need that we had identified, it was a need identified by Norfolk and Suffolk Foundation Trust, by the Wellbeing Service, and by people accessing services. So we haven't created this idea behind the scenes. We have gone out and spoken to people that access services across Norfolk, and we've co-produced this idea to bring something to the community of Norwich that can be used by anyone living in Norfolk and Waveney, where they have that sense of community and get that extra help. So I think just that collaborative approach that we've taken to add something really amazing that focuses on people's strengths and the positive parts of their life and their well-being, it's really unique, and it's just a fantastic idea. So I think what people can look forward to when our physical space opens in 2022 is a really vibrant, alive, comfortable, approachable space where it is open to everyone. So you can be coming into that space to go to a cafe, to have a coffee. It can be as you're walking past, it can be sitting there, you could be studying there. And we really are looking forward to just having a whole different group and cohort of people just filling that space and bringing it alive themselves. So it's this community feel. We've got the cafe, but I'm also really looking forward to having this resources library that really focuses on mental health and gives people that knowledge that they might need, because I think with it being so open, what I'm looking forward to is having people coming into that space because they may be experiencing something with their mental health, or they may have a friend or a family member, or thinking about the impacts that COVID has had on our sense of community. It may be actually they've noticed someone in their neighbourhood that may be struggling with something, and they can come to us and they can use that resource library to find out about what they can do and how they could help. And I think I'm just really excited about people being able to have this space that they can come to where they are empowered to find what they need from it. So one of the things I'm really looking forward to is the fact that we've got this beautiful building, Grade 1 listed. It's already got this amazing history being in the centre of Norwich, and we're turning it into this community space that is going to be warm, comfortable, vibrant. But what brings it alive is the people that are going to be walking into it, the people sitting on the seats, using the services, coming in, walking around the gardens that we've got, and they're going to be the life and blood of this service and this building that we've got in the centre of Norwich. Really is about empowering people to identify what they can do in their own journey of recovery, and we will be there alongside them to help them do that.